Alright, before I start, I'm sorry if the computer shakes or if the dog or the cat decide they needed to come behind me and the computer's shaking now. Because I am trying to do this at home. So, my case study is on an elderly female patient in her 70s. And for the purposes of the presentation, I'll call her Mrs. Smith if I need to use a name. She is 5'4", 170 pounds. So Mrs. Smith was admitted to the hospital on the night of the 26th. Her family called EMS after finding her confused and disoriented. And at 3:30 p.m., her son was visiting her, and she was fine, normal. And then he tried to call her at 4:30 p.m. after leaving. And he had no response, so he drove. She didn't answer the phone. So he drove over and found her confused and disoriented, at which point he called EMS. So her labs upon entering the ED, her potassium was a little bit low, 3.3. Her glucose was a little bit high at 165. Her creatinine and her BUN were both elevated. Calcium was a little bit low. Her protein was high. And she had some positive troponins at 2.92. Her white blood cell, red blood cell, hemoglobin, and hematocrit were all within normal ranges. So they immediately did an EKG on her, and they found some PACs, but otherwise she was in normal sinus rhythm. So they started her immediately on heparin after finding her troponins elevated. And they also found that she had a murmur in her heart. She was also aphasic, and they tried to do a swallow study on her, which they were unable to do. Every time the nurse would put anything near the patient's mouth, she would shake her head and pull back. So they did an MRI on her after all of this, and she got onto the floor first, and then they did the MRI. And they found some multifocal small embolic strokes with hemorrhagic conversion. And she had past history of hypertension, hypothyroidism, diabetes type 2, renal insufficiency, vitamin D deficiency, arthritis, and aortic stenosis. She's never been a smoker, and she doesn't drink alcohol currently. She's had a history of a knee replacement and a hysterectomy. She's also allergic to morphine and sulfa drugs. So at home, she is on aspirin, cholesterol medications. The cholesterol wasn't in her health history, but because she's on these medications, I'm assuming that she probably has high cholesterol. Those medications included fenofibrate and pravastatin. She also was taking amlodipine, Avapro, Lisinopril, hydrodiureal, and Lopressor for her hypertension. She was also on allopurinol for her renal insufficiency. She's also on Lantus at bedtime and metformin for her type 2 diabetes. Synthroid for her hypothyroidism. Vitamin D3 supplement for her vitamin D deficiency, and some Prilosec for some heartburn I'm sure she probably had. So all of those medications minus the Lantus were taken PO by mouth. So as you can imagine, she could not take anything by mouth because she was refusing. So in the hospital, they had her on some drips, and then they switched over some of her main medications that she couldn't go without into IV pushes or suppositories. So she was on a normal saline drip at 75. She was on a heparin drip for the strokes that they found, as well as the elevated troponin. Her heparin drip was going to 750 units an hour. And she also had Zithromax ordered for probably a possible UTI. She's elderly and a woman. Those happen frequently. She also had a Tylenol and aspirin suppository ordered. Sorry about that. Tylenol and aspirin suppository ordered. The Tylenol, in case the nurse thinks that she's showing like facial grimacing or something like that to indicate that she was in pain, the nurse can give her the Tylenol suppository. and then the aspirin suppository because she was taking the aspirin at home. She also had Synthroid injection as well as Protonix and low pressure injections ordered. All of them were once daily. The low pressure was also ordered Q6 hours PRN if her blood pressure became elevated. And then the Synthroid for her hypothyroidism and the Protonix for her heartburn that she had at home. So her vital signs, she varied between 80 and 130, so she would come between sinus rhythm and sinus tachycardia. Her oxygen was always at 100% room air. Her BP would fluctuate between a lower pressure and a higher pressure. It didn't really get any higher than like 160/80, which is good, but it's probably because not only was she showing, these symptoms of heart attack, stroke, all these other stuff, the elevated troponin, but she was also on numerous high blood pressure medications at home, and now they only had the low pressure IV to give her because she couldn't take anything by mouth. They were also doing stroke assessments on her Q2 hours for 24 hours. They were unable to do the regular, smile, hold your hands out assessment, so they had to do the Glasgow Coma Scale on her because she was unable to follow commands. So they had to do the Glasgow Coma Scale on her, which included the spontaneous eye-opening, motor response, and verbal response. Also, they did the pupillary reaction, Perla, pupils equal round reactive to light and accommodation. So in her assessment, she didn't show any signs of skin tears or ulcers or anything like that. She did have some missing teeth and diminished lung sounds in her lower lobes. And she had non-pinning edema in her legs, and her pulses in her legs were also weak. And she had, some hypoactive bowel sounds. So, the morning of the early morning of the 27th at 1 a.m. after she came up onto the floor, she had a bladder scan done on her, which showed 800 milliliters of urine. And so the nurse decided to call the doctor, let him know, and the doctor ordered the in-and-out cath. So the nurse did the in-and-out cath on her. So the nurse did the in-and-out cath on her and got 600 milliliters out before it clotted off, and we were unable to get any more out. And we also sent a UA down during the in-and-out cath. We did a clean catch into the cup and got the results back. At the specific gravity was a little bit elevated at 1.024. pH was 5, and she had blood, bilirubin, protein, a few bacteria, and some hyaline casts found in her urine as well. So on the 28th, she was showing signs of expressive aphasia, and she was following commands and getting better. So she had a Doppler done, which showed no DVT and some fluid overload in her lower legs. She also had some consults done, physical therapy consult, which they weren't able to get her out of the bed just yet, but they were able to talk to the family and figure out that she uses a walker and a cane at home, and she also was living independently. She had speech therapy also come, and they were able to get her to swallow some liquids and some puree with prompting, so they had to talk her through everything and get her to do it. She also had a dietitian consult, and the dietitian added a Glucerna shake because her protein was low when she came into the ED. Neuro came and saw her. They recommended a TEE done. So on the 28th, when her labs were drawn, she had a troponin at 35.11. And so cardiac wanted to do a cardiac cath on her, but they were unable to do so because she has some renal insufficiency, so she wouldn't be able to get the dye out. So they did order an echo for the next day to see if they can try and see something. And so her labs on the 28th were drawn. I like I said, she had the elevated troponin. Her sodium chloride, CO2, and glucose were all within normal limits. Her potassium was fine as well. It came up to 3.6. Her BUN and creatinine were still elevated, and her albumin was still low at 1.4. And so now her hemoglobin, hematocrit were all low. Her hemoglobin was 8.4 and her hematocrit was 24. So my guess is they're probably going to order some blood for her, or they probably did order some blood for her. So during the 28th, that night, her CBGs kept dropping, and they would drop into the 20s, into the 30s, into the 40s. So they were doing her blood glucose every 4 hours. And when her CBGs would drop low, the nurse would give an amp of D50 and would bring it back up. And then probably about 6 hours later, it would drop again. So she was also had a Foley placed on 28th. She had some SCDs put on, and she was ordered Q2 turn. She was actually ordered Q2 turn before that. And she had 2 IVs in place as well, one on each arm. The IV team had to come because her veins were very hard to get. So her care was good. The nurse was definitely her advocate in this case. She came in, and for some reason the doctors decided that they needed to give her all of her medications that she was taking at home ordered, and all of her medications she was taking at home were all by mouth, which she was unable to do. So then in this case the nurse had to advocate for the patient and get the doctor to prescribe at least some of the major medications to IV push or a drip or something else that they can get into her suppository. And so he did change over the Lopressor and the Synthroid for her. She also probably would need some calcium. Her calcium levels started getting low near the end. She came in with it low, but they kept dropping. As a woman, as an elderly woman, you're expected to see a low calcium, but if it keeps dropping like that, then you need to start giving them some more. Because she couldn't eat the first day is probably why her calcium dropped. Hopefully with maybe the Glucerna shake it would increase. If not, then the nurse would probably also need to be an advocate and prescribe some more calcium, or get the doctor to prescribe some more calcium for her. Overall, she seemed good. She was improving, which is a good sign, and I hope the best for her.